Welcome to the 2012 NKF Spring Clinical Meetings. I'm Dr. Judith Beto, and on behalf of eAJKD, the electronic version of the American Journal of Kidney Diseases, we're happy to have Dr. Judith Beto from Loyola University talk to us about talking control therapy with dialysis patients. Dr. Beto, welcome.
Thank you very much. I appreciate it.
Tell us a little bit about talking control for our viewers who haven't heard of it before.
So talking control is a cognitive behavioral technique that is likened to befriending. So you're basically sitting down with someone and speaking about common things to develop rapport between two people to create a common language or a common body of conversation.
Now you and your group have done interesting studies with talking control with your dialysis patients, specifically 2 studies, and I'd like you to tell our viewers some of the data you found.
Basically, we decided that we wanted to improve the communications of our patients, so we decided that we would spend for 2 waves of patients. The first one, we spent 10 minutes a week, 5 to 10 minutes a week, when we walked around in their dialysis setting. We would speak to them about just anything, a conversational nature of 5 to 10 minutes. And then in the second wave, we actually did it in 20-minute increments, 10 to 20 minutes, to see if the additional time actually made a difference. And what we found is that the patients, generally speaking, appreciated any time that we gave them, but that 5 minutes alone was enough to make differences in stabilizing their lab values and in increasing our patient satisfaction survey in our unit.
And specifically, the lab values you and your group have looked at were albumin, PTH, and serum phosphorus.
That's correct. That's correct.
Now, can you speak a little bit about the cost of such a program in an era of the bundle and with a lot of skeptics watching this video? How much would it cost to implement something like this?
Well, in our mind, it's part of our availability of our current team. So we looked at the math. We have 120 patients, approximately 12 staff that are willing to do this. And that would be, if we divided by that, there would be 10 patients per month that we would take under our wing, and we would spend 10 minutes a week on. So that's about 100 minutes a week, which is a little over an hour, which we felt would be worth doing. And if we wanted to do 5 minutes a week, it would even be less than that. So it's part of our natural genre. We would divide it among the shifts, we'd pick names, and we'd try to just be cheerful and befriending, as if it was an oral Facebook exercise instead of something on a computer.
Now, where do you and your team go from here with this exciting research that you guys have conducted and promising data? Where do we see next?
I think what we're trying to do is to probably just step it up a notch and be more consistent. We only used about 38% of the unit. So we'd like to actually do it with a wider variety of patients, some that might be more resistant to talking to us, to see some of the barriers and threats. We find that most patients are very willing, but some of our patients do sleep during dialysis. So we're going to have to work around that and to try to catch them at a time or make it so compelling that they're going to want to stay awake and maybe leave us a card saying, "Wake me up, please." That would be our goal.
Well, this is fantastic research, Dr. Beto. Congratulations to you and your team for a wonderful set of data results and being here at the NKF 2012.
Thank you so much.
Thank you very much.